Hi, Tasha. We're going to go through the assignment. I was thinking that we had the answers to number one. Maybe you just didn't view them. Without the poisoning here, looks great. You also want to code. We have the gait and nausea with vomiting. I'm not sure what R56.1 is. We have visual disturbances. You did good on the HIV. We also want epilepsy. We're still going to code the intracranial injury. We're just going to put an S at the end. And then again, we do need that activity code, the V code with an S on the end too. Let's move to number 3. All right, with number 3, one thing you need to really remember, because these will be all wrong on the exam, is that when you have an adverse effect, you want to make sure that whatever's wrong with the patient is first. Then the adverse effect code, the T code, is second. And it looks like you have the great malignant neoplasm code, which is correct. We also have an excision of the right lower arm, so you needed to add that in there too. Number 5, B20 needed to be first. Keep in mind the histoplasmosis is related to the AIDS. Whenever you have a diagnosis related to the AIDS is listed first. Same thing with pneumonia. If you have pneumonia because of the AIDS is going to be listed first. Now, if I come in with a fracture of the femur, it doesn't have anything to do with the AIDS, then I'm going to code the fracture of the femur first. So this is really important to remember. So we have that first, the B39.9, you're off a little bit on that. T37 5X5A, adverse effect, so that's good. And don't forget your procedures. So let's go ahead and go down to number 7. 7, you did well. It looks like we need 3A on these, or I'm sorry, 1A. Keep in mind these are all poisoning, not adverse effects. So poisoning is always listed first. The J code is in here for acute respiratory failure. We also have our 2 procedure codes. Number 9, nausea with vomiting. This is an adverse effect. You always code what's wrong with the patient first, and then our T code for the adverse effect second. Number 11, same thing, adverse effect. The embolism needs to go first. So really review the rules on sequencing. That's what I was trying to come out with. Don't worry about the B code. I tell students that they do not have to code x-rays because they're non-invasive. The charge master is going to pick those up in the hospital. So with this one here, we have poisoning that needs to be first. T39, T51, looks like you have the codes correct. You have the F10, so good job on that. Let's go ahead and look at chapter 21. If you want more practice, I'm going to give you the answers to all of them. Highly advise that maybe you get a chance to go through some more. Okay, it looks like you're good on number 1. Number 2, just off a digit, D62, which is great. Close also here on the procedure code. We also want a revision code for the hip joint. Okay, I do have students using this M code. I'm going to pull this up. So it is M87.062. We have idiopathic aseptic necrosis of the left tibia. That's what I have students putting down. So with this one, let's go ahead. I'm going to make this bigger. So with this, I am not sure why I have students coding this. You want the mechanical complication. the necrosis, and I'm thinking instead of the complication necrosis, students are putting the M code in there instead, which they should not be doing. Pull this back in. If you have any questions once you read through that, let me know. The biggest thing here, you're missing quite a few procedure codes on this one. Okay, number 4, M27.2. Missing again, we have excision. You're missing a few. Personal history code. Number 5, the J9 5.2 code should be first. Then our cancer code. Insufficiency is example of intraoperative complication. So we need to have the respiratory insufficiency because that necessitated admission as an inpatient. And then number 6 looks great. Any questions on this, please let me know. But make sure you review the video, review the answers. I'll have them as an attachment. Try to do a few extra before the exam and really remember your sequence.